Derick Mitchell here on December 7th at the Department of Health in Museum Plaza in Dublin. Just come out of the stakeholder consultation event that the Department of Health have organised around the new upcoming health information bill. Delighted to be in the room with many other stakeholders looking at the different elements of the health information bill, and it's very clear that the three main elements of the bill are coming together. Those three elements are the role of the National Data Guardian, which is being modelled on the National Guardian in the UK, and we had a presentation from the UK's National Data Guardian today. The other element is the agency, the national agency that's going to be charged with collating and collecting, but also protecting and sharing health information in Ireland, and that's going to be an important role. And then the third element is the rights that people will expect to have as part of this legislation, in terms of not only getting access to their health information, but being more in charge of and being a key stakeholder in the use of that data for a range of different purposes. So great to be in the room, and it's great that several mentions were mentioned too around citizens' juries and the role that patient groups and individual service users can play in this, not only the development of the legislation, but in its ultimate implementation. There was probably two elements that I probably haven't heard yet in any great detail about how patients and the public are going to be engaged and energized as part of this process. So the other element is around a little bit more clarity about the agency that people are going to both receive and then use as part of this new way of accessing their data, and then empowering them to be far better citizens in terms of the use of health information for purposes beyond their individual care. So lots of discussion, lots of healthy debate, and it's something that we'll be following up with in IPPOSI over the coming weeks and months. Check out My Health, My Data on our Twitter page to follow some of our messages around this, and we will be back in touch shortly in the new year, where no doubt we will see the beginnings of the heads of this bill. So with that,